We may be starting to move past the COVID-19 pandemic, but for people in our hospitals, they are still feeling the side effects.
Well, new data is projecting that the labor shortage felt by nurses across the country may only be getting worse. 4 News Now's Natalie Grant is breaking it down for us.
Aaron, Kirsten, a new study released by the National Council of State Boards of Nursing is painting a clearer picture of just how much of a toll the pandemic took on nurses across the U.S. Now, according to this research, 100,000 nurses left the industry over the past 2 years due to issues like stress, burnout, and retirement. By 2027, researchers are projecting that number to rise up to 900,000, which equates to 1/5 of RNs nationwide.
There is a great need. It's consistent.
For many, the pandemic put in perspective just how valuable a nurse can be. But since then, those same nurses have said goodbye to the bedside.
There is a lot of concern about what they experienced and what that has meant for them with their future in their career.
Ann Mason is the Associate Dean for Academic Affairs at WSU's School of Nursing, training the next generation. And after a hard couple of years, she says they have added elements focused on mental health and resiliency into their curriculum. But while the number of nurses in the hospitals have waned, theirs have stayed strong.
I think there has been a really consistent awareness that it's very challenging. What I've also seen, though, it doesn't seem to be causing them to shy away.
Just focusing on Washington state, some research is saying that it's the hospital's demand that is causing the shortage. But people that are working those front lines say conditions are still not where they need to be, especially when it comes to patient loads.
These conditions were in place well before the pandemic, and then the pandemic comes along and is essentially the straw that broke the camel's back.
And those unsafe conditions are what is pushing people to leave it behind.
We have over 101,000 nurses in the state of Washington right now. Only 61,000 nurses are working at the bedside.
Hoping for a solution and a brighter future.
Right now, we're in a tough spot, and we're seeing nationally some difficult data, but I think we have the right people talking about those issues and coming to the table with solutions.
Now, we did reach out to local Spokane hospitals to see how they're faring amid this shortage. Now, Providence health leaders say they're hoping to recruit more staff through things like high pay and sign-on bonuses. Meanwhile, over at Multicare, they say that they'll be doubling new grad hires over the next 2 years. And if you'd like to read those full statements, you can find them on our website, kxly.com. Reporting live in studio tonight, Natalie Grant, 4 News Now.